Hello to all my listeners and welcome to the CardioSeeds podcast that is all about lifestyle medicine and provider burnout. I'm your host, Dr. Svetlana Shimon, a double board certified preventive cardiologist, lifestyle medicine physician, and health and wellness coach from the suburbs of Philadelphia. My amazing guests include absolutely cool physicians and other healthcare providers, and all of them have unbelievable stories to tell, from incredible personal tales of survival and resilience to becoming successful entrepreneurs, to starting blue zones from scratch, and much, much more. Tune into CardioSeeds podcast and listen to my discussion on a variety of lifestyle medicine topics. Starting a podcast was one of the best decisions I made in my life, and now we are available on every platform with a robust following from you, our listeners. Of course, none of this would be possible without Buzzsprout that let us build this podcast from scratch and launch it very, very efficiently. So, if you are dreaming about having your own podcast for the first time, Buzzsprout should be your choice. And with that, let's get started. Hello, and welcome to this episode of the CardioSeeds podcast. I'm your host, Dr. Svetlana Shimon, and I promise you that today we'll have an incredible podcast episode because we have one exceptional guest today. Dr. Mahima Gulati is a triple board certified physician. She is certified in endocrinology, diabetes, and metabolism, as well as internal medicine and lifestyle medicine. And this busy doctor wears many hats, of course. First and foremost, Dr. Gulati is the medical director of lifestyle medicine program at Middlesex Health in Middletown, Connecticut. As the program director, she has tasked with the strategic vision, formulation, and tactical implementation of a rigorous, evidence-based lifestyle medicine program, as well as building an internal and external referral network for patients to utilize lifestyle medicine, including its unique pillars like culinary medicine in the care of their chronic ailments. As a senior staff attending physician in endocrinology, diabetes, and metabolism, Dr. Gulati routinely provides evidence-based clinical care for various endocrine disorders and hormonal disorders. And as associate professor of medical sciences at the Frank H. Netter School of Medicine, Quinnipiac University, she teaches both endocrinology and lifestyle medicine to medical students. She has also been elected to the prestigious Board of Directors at the American College of Lifestyle Medicine in November 2022. A medical society with over 9,000 members from various healthcare professional fields, a term which is currently serving. She has been a speaker at numerous regional, national, and international conferences, as well as published several journal articles and textbook chapters on both endocrine topics and lifestyle therapeutic approaches. I wanted to specifically mention that Dr. Gulati is a co-author of an expert consensus statement from the American College of Lifestyle Medicine, which is called Dietary Interventions to Treat Diabetes, Type 2 Diabetes in Adults with a Goal of Remission. The consensus statement was published in the Journal of the American College of Lifestyle Medicine in May-June 2022 and provided the first of its kind comprehensive literature review and recommendations on using diet as a primary intervention for the reversal of type 2 diabetes. Dr. Gulati, welcome to the CardioSeeds podcast. It's our pleasure and honor to have you today.
Oh, thank you so much, Dr. Shamoon. Thank you so very much for your kind and gracious introduction. It is truly my honor and pleasure to be here with you today.
Oh my goodness, Dr. Gulati, I have so many questions for you, but let me just start with this. Where did you grow up and how did you decide to become a doctor in the first place?
So I grew up in New Delhi, which is the capital of India. It's a huge city with a very, very big population of people, and it was fun to grow up in India. How did I decide to become a doctor?
Mm-hmm.
Well, I think I was always drawn to human biology. Even as I would say a middle school or a high school student, I would find myself drawn to biology textbooks. I really enjoyed how the human body works. And it was kind of a natural gravitation. The other thing that pushed me towards that was, back in the cities in India in those times, it was kind of aspirational for middle class children to grow up and become professionals in,
Mm-hmm.
sciences, technology, engineering, mathematics, humanities, those types of fields. And so, there was always this cultural and parental kind of encouragement to pick up,
stimulating environment.
Like being a doctor.
Mm-hmm. Yeah.
And so that was very helpful. But I think it was also what I found fascinating. I just found it very interesting. I still do. I really love how the human body cells work.
Mm-hmm.
And, really kind of finding out every single day, discovering new articles on things like, irisin's, molecule that's made by the muscle cells
Mm-hmm.
that may actually help prevent or, reverse Parkinson's, not reverse, I should say, prevent or decrease the effects of Parkinson's disease by decreasing the, accumulation of bad protein molecules in the neurons. So it's fascinating. I love it. I just love it. That's why I thought it was going to be my thing to do.
And was anybody in your family a physician, or it was just you?
Actually, no. In my immediate family, my mom, she worked in the secretarial department in large financial corporation,
Mm-hmm.
and my dad was a banker. So I was the first in my family, although, in my extended family, we had a couple of cousins.
Mm-hmm.
But no, that was nobody in biology in my immediate family.
You're the first one. That's so fascinating.
Yes.
And so when you came to the United States, you came as a doctor, as a clinician already, or you trained here?
No, I actually trained in Maulana Azad Medical School in New Delhi, India.
Mm-hmm.
And I had completed my MD, and I came here. I did my medical licensing exams, the USMLE exams.
Yeah.
And I knew I was going to do residency in internal medicine when I came here. I interviewed and I found a spot in the Bronx in New York City. So I started my residency here.
Right. How did you find, what was the difference between practicing medicine back home in India and in here, if you could compare? I understand that you probably did not have much time or chance to practice medicine back home, but if you had any chance to compare practice of medicine there and in here, what would you say?
I think they are both their unique set of challenges.
Mm-hmm.
The medical school that I went to, they are affiliated with 3 different hospitals. And as you can imagine, infectious diseases were big.
Yeah.
In India, we had the largest tuberculosis center in the entire country, possibly the world. And as a matter of fact, a few of my medical school colleagues, my friends, co-students ended up getting multi-drug resistant tuberculosis working in the hospital wards. And, I saw really things that one would not imagine seeing here in the US, like dysentery, like cholera.
Mm-hmm.
So infections were big. And, there was obviously rampant poverty, malnutrition, iron deficiency, anemias, even things like, vitamin A deficiency, seeing kwashiorkor or marasmus, which are, severe protein and calorie malnutrition diseases in children and in pregnant women.
You just reminded me. You reminded me of things that I haven't seen for 35 years.
Exactly. So it is, it's obviously a very resourced and understaffed as well. I remember being in the OBGYN wards and, pregnant women, because of the shortage of beds, there were 2 pregnant women on the same bed with their children, their newly delivered children sometimes.
Right.
So it was really, very challenging in its own unique way.
Yeah.
When I came to New York City, I really found it, it was like, a beautiful experience in my life. The 3 years of being a resident in New York City will always be etched in my memory as, the 3 most special years of my life, really, because, again, the kind of pathology we saw was phenomenal. People would come because we were a big ER. People would come with, obviously there were all kinds of chronic diseases and acute conditions. We actually, interestingly, saw quite a bit of infections, even in the Bronx, New York.
Yeah.
Because, New York City has, a huge kind of a panorama of people from all across the globe.
Sure.
But it was really a very fascinating experience because I learned some amazing algorithms and protocols. We had some of the most reputed and talented scientists from the world who worked there.
Sure.
And my mind was blown by the practice of modern medicine. One thing, Dr. Shamoon, that stood out to me when I came to the U.S. really is, primary care, which is the concept of prevention.
Yeah. That
people actually have a primary care physician that they go to every year at least, ideally more frequently than once a year, for just prevention, not because they are sick. And that was a unique, kind of a novel concept to me, because when I grew up in India, people only go to medical doctors when they are actually sick, if they have, let's say, cold or bronchitis, or they need antibiotics, or they have a urine infection.
Right.
That's when they seek medical care, typically. I'm thinking that things have changed because this was way back when. This was more than 15 years ago when I grew up. And I'm hoping that at least in the bigger cities, that concept has changed.
Yeah.
But I found it amazing that, in the U.S., people seek preventative care. So there is preventative cancer screening. There is preventative, cholesterol screening or sugar screening, so that people can find out ahead of time before they become symptomatic if they are, approaching an illness. And that to me was a very sort of a seismic change in thinking. And I really appreciated that coming here.
Well, let's talk a little bit about this and about the differences actually between those preventive screening tests and preventive care, in the Western world that we all admire and really cherish. And really the art and the science of lifestyle medicine and lifestyle medicine interventions for chronic disease prevention, treatment, and reversal, right? Because I'm not going to even ask you, because from what you're telling me now, I kind of figuring it out myself that you probably did not get any training in your medical school on lifestyle medicine interventions, right? Because we are from abroad, we were trained abroad, but also every single physician or nurse who was trained here in the United States, whom I got a chance to talk to, they told me that they did not learn much of or anything at all about lifestyle medicine interventions or modifications for chronic disease prevention, right? Treatment or reversal from their formal schooling. Moreover, our traditional practice models here in the United States are centered mainly around counseling patients on diagnostic tests, medications, or procedures, right? And each one of us found lifestyle medicine, and we will explain to our listeners who are not familiar with the concept in a second what lifestyle medicine is, but each one of us found lifestyle medicine in our own way. Of course, there is a huge role for use of medications and procedures in managing appropriate cases of both cardiovascular disorders, like in my case as a cardiologist, or endocrine disorders, as in your case as an endocrinologist. Having said that, we know that more than 80% of all the chronic diseases in the Western world are related to poor lifestyles, and thus probably preventable with modifying those very lifestyles, right? So the difference between preventive measures in the Western medicine and lifestyle medicine interventions are huge. Let's explain to our listeners what those differences are and what lifestyle medicine has to offer, and specifically what lifestyle medicine program at your institutions is about and what it offers. It's kind of a big question, I know, but maybe you can break it down into like several. So the difference between lifestyle medicine and other preventive measures, what lifestyle medicine about, and what is your program about?
Absolutely. No, that's definitely a very important question. So, in a way, like I said, it was an awakening to me that people are proactive about making sure that they give preventative care, whether that's with their primary physician, whether that's with their OBGYN, or whether that's with their dentist even, or their eye doctor. And as you very astutely mentioned, these are all these diagnostic testing, sometimes even imaging, etc., that we can do to make sure that we catch a disease process that's beginning, that's incipient in its early stages, and we, kind of arrest it and we take care of it right away. And that's, really wonderful. That was, a very good concept that struck me when I came here and started my residency. But then way down the lane, I think I was a practicing attending physician in endocrinology. So I had completed my fellowship and I had been practicing for many years when I found lifestyle medicine. And that was an eye-opener again for me. Actually a bigger eye-opener because, the concept of lifestyle medicine is actually, in a way, primordial prevention. Or maybe even more foundational than that. It's actually the cornerstone, basically the base on which the pyramid of health can be formed, right?
Right.
Or health building, really. It's not just about the lack of disease. It's about actively building health.
Right.
And, lifestyle medicine is not only for prevention. So it's not for somebody who's healthy, how do they prevent themselves from getting sick?
Yeah.
It is for every single human being on the planet, whether you're sick, whether you're really terminally ill, or whether you have absolutely no medical conditions whatsoever, you're in the, peachiest of health. It can not only prevent problems, it can actually treat, and in some instances, depending on how intensively one is applying lifestyle behavior changes, it can even reverse pathologies in some instances.
Right.
So it's not only preventative, it's very foundational, it's elemental, and it comprises, as you mentioned, it's basically an evidence-based specialty that comprises 6 pillars. We define it through 6 pillars, which are, number 1, our nourishment or, our nutrition. Number 2, our physical activity or movement. Number 3, our sleep, both quality and quantity of sleep.
Right.
The restorative effects of our sleep or rest. Number 4 is our, not using substances which can be potentially addictive, for example, tobacco or, obviously recreational drugs. Right. And not, overusing alcohol. That's number 4. Number 5 is, managing our stress, because stress is the absolute, ubiquitous reality of human existence. And managing it in a healthful manner, in a positive manner, and not letting the stress affect our health.
Right.
And last but not the least, which I think is my favorite pillar, is our connection with other individuals, with other creatures, whether that's our family, whether that's our workplace, our colleagues, whether that's our neighbors, whether that's our pets or other, living beings. And
let's also stress,
bi-directional sort of connection with other people who exist or other, living beings.
Yeah, I would like to also stress positive.
Health, right? So these are the 6 pillars, which is lifestyle medicine. And Dr. Shamoon, I'll let you speak. I didn't want to speak.
Oh, no. Absolutely. I just wanted to stress the word positive social connectedness, positive, the word positive in this case as well. So like, the mitigating stress in a positive way, also social connectedness, positive connections are beneficial for us. And obviously negative connections should be at all costs, eliminated at all costs, if at all possible, right? Go ahead. I did not mean to interrupt in any way.
No, that was, I think that's important to, have sort of nurturing and uplifting connections with other living beings.
Yeah.
So these are the 6 pillars. And, as you know, and as all of us who do lifestyle medicine know, these are absolutely the cornerstones of our health. Our entire existence, our biology really is affected deeply by every single one of these behaviors, right?
Mm-hmm.
And there is a huge amount of evidence. This is not something which is foo-foo medicine. This is really very, the science on this is really unquestionable.
Yeah.
It's been there since, I think, decades now.
Mm-hmm.
We may or may not be implementing it in our practice in a rigorous way, but it's there. And it's really irrefutable. And I think we're going to talk a lot about the data on these different behaviors and how they affect different disease processes or the risk for these diseases.
Yeah.
And as you mentioned very smartly that, more than 80% of all the healthcare dollars that we spend in the Western world, particularly in the US for sure, but, I think in most developed countries, a lot of that expenditure could be decreased, the burden could be decreased, and obviously, a lot of lives would be saved, a lot of life expectancy could be improved just by focusing on the science and the implementation of lifestyle medicine.
Yeah.
So it is it's the absolute crucial, critical need of the hour. And to that effect, talking about implementation, the third part of your question is, how do I apply lifestyle medicine in our program?
Yeah.
So, lifestyle medicine, we built this program, I think we started in 2019, but it officially became a program in 2022. The pandemic kind of sort of slowed down the marching of the advent of lifestyle medicine in our health system. But, it's officially a program. Now we have quite a few providers, including physicians, including other professionals, like physical therapists, etc., who are board certified in lifestyle medicine in our health system. And, we were, I was lucky, we already had integrative medicine in place in our health system. And, what we do is, number one, clinical implementation where, we see patients for purely lifestyle medicine consults. And that's, one-on-one consult with me in endocrinology, but there are some other physicians in other divisions, including family medicine, who see them in that division. And then, in endocrinology where I work, we also do follow-up visits. Obviously, one-on-one are done all the time, but we do shared medical appointments, which are, whoever is interested in participating, and these are culinary sort of medicine-based shared medical appointments. So we always have a cooking demo, always, as part of these group visits. And, usually several patients show up. And we talk about different pillars at different appointments. So one appointment might be based on stress management, the other appointments based on sleep, the other appointments based on physical activity, etc. And so these are kind of different from your run-of-the-mill follow-up appointments with a endocrine physician, right? And that's the clinical part of the lifestyle medicine program. The other part of the lifestyle medicine program is the education, which is kind of I sit on the GME CME committee, and we kind of try to create events or grand rounds or conferences which are focused on lifestyle medicine. We have tried to bring in different speakers. The president of American College of Lifestyle Medicine, Dr. Beth Fades, was our keynote speaker 2 years ago at our, organizational. We do a symposium annually, the biggest, residency symposium.
Yeah.
Typically in summer. So she was a virtual speaker at that time. And we have covered, other topics like burnout, etc. So that's the second part of the program, the education, educating not just residents, but also faculty, specialists, and obviously other professionals, whether those are, dietitians or occupational therapists or respiratory therapists, etc. And last but not the least is just kind of like synergizing or, kind of building the network with different stakeholders among the health system. So, I also belong to the wellness committee. I'm the physician representative on the wellness committee.
Yeah.
And I work with behavioral health. I work with, obviously, my integrative medicine partners, my occupational medicine partners, there is actually a mindfulness and compassion committee in our center with those partners, with sleep medicine, of course, with physical therapy, to synergize and kind of collaborate and get the word out there for lifestyle medicine. And so, we have been able to create some really good resources intramurally inside our organization. To provide this, we have done some publicity on local television networks and local newspapers. Patients have heard about it from those sources, or they have heard about it from their friends or neighbors, and they have, referred themselves to this lifestyle medicine service. And it has grown substantially over the last 1 year, actually. The volume has grown, the interest has grown, and there's a huge demand for lifestyle medicine among patients.
As you were talking, I was thinking to ask you this. Lifestyle medicine programs are notoriously difficult to push with healthcare administrators, right? To institute them. How did you manage to do this and to become so successful in such a short period of time? Is this because your hospital is a part of the Mayo Clinic network? It was easier because of their support? Or how did you do that?
Actually, no and no. It was never easy, and I still face a lot of skepticism and, kind of questions. I think what helped me was, honestly, Mayo Clinic was not part of the equation much at all.
Yeah.
I just was lucky because I had a chair of medicine who supported lifestyle medicine. She's a believer. She believes herself in healthy behaviors. And so she was very supportive of the idea. She's no longer working at our health system. So, but she was the one who was my mentor when I first decided to go and get board certified. And then my immediate medical director, she is tremendous. She actually went and attended the lifestyle medicine conference herself in June, I think in June 2019, when she heard about it from me. And she, went there. She listened to all the speakers. She listened to all the science, and she really wanted to bring this to our health system.
Yeah.
And she is the one who connected me with, our chronic care management, our dietitians, to make sure I get cooking demos as part of my shared medical appointments. So she really connected a lot of dots. So I really, was very lucky to be with other professionals who wanted to bring this.
Right.
Do I face, sort of challenges in terms of, sometimes there may be folks who may, not understand the merit of this. And that comes up periodically, actually. But, I think, thankfully, my immediate mentors and leaders have seen the passion that I have. And it also helped that other, physicians and residents were interested in this.
Yeah. You need a team.
Now there is a volume, so hopefully that speaks. But I have to agree, it's not easy.
Yeah.
It's not easy in any health system. And I have to tell you that it sounds fantastic right now as I speak, and maybe I'm being a little hyperbolic. But there were so many nights of, lost sleep and really trying to make
doubts.
points
Yeah.
and going back and
Sure.
really trying to convince whoever I could convince. So it wasn't easy, and it still is not very easy. There is that hardship, and I wish it wasn't. But when I sat like you mentioned, I'm on the board of directors, and I've sat in on a few meetings with other health systems and their representatives.
Yeah.
And I remember Martin Kell, who's the, I think, Director of Partnerships and Strategies at American College of Lifestyle Medicine. He, kind of casually mentioned, okay, raise your hands for whoever thought this was, or whoever's having an easy time trying to do this in their health system. Mm-hmm. Obviously, nobody raised their hands because it is an uphill battle.
Right,
sure. So
yeah.
I do want your listeners to not get discouraged. Maybe I had it a little easier because of the people who were with me.
Yeah.
But at the same time, you're not alone. It's definitely been tough for all of us.
Do you think
was connecting with people like you? People like you who are believers of lifestyle medicine, and it's not like it's not a dogma, right? Doesn't need to be a believer, right? But who really want to pursue it passionately, who understand how deeply emergent it is to implement this clinically and to be able to offer this to patients.
Yes.
That's what kept me going. If I'd been alone, whether that was at my own organization or even just at a more global basis or at a more sort of a wider level, I would not have been able to.
Not be able to. Yeah.
It was only the fact that I had other people who understood my desire to bring this, that I was able to go ahead and keep on going despite those roadblocks.
Yeah. I'm here in Philadelphia area, and we have 5 medical schools around here. And, you've been here, your husband trained here, right? And so we have a large number of medical providers here, physicians and other medical professionals in the area, and huge number of hospitals and other facilities that could benefit from all this, like programs, lifestyle medicine programs. However, it's been, rather, as you say, an uphill battle for this area because of the reimbursement issues, and probably many people who are not familiar with the concept, they just don't know how the reimbursement works in lifestyle medicine, and there are so many ways to reimburse for all lifestyle medicine programs and interventions. So education and information in this domain means a lot, means everything essential, like everything in every other field, right? But I feel like if providers, if physicians or nurses, NPs, had a chance to attend at least one of our conferences, professional conferences, American College of Lifestyle Medicine, and listen for themselves and communicate, network with providers in their fields or maybe even other fields, and hear how the tools and the processes and the models, the practice models work and work out successfully. Like David Donahue worked out his practice model in Wilmington, Delaware, for instance. This would not be as difficult in their minds, at least, and when they talk to their administrators and try to persuade and show numbers and all that stuff. And I also feel like inviting healthcare administrators and executives to those meetings would be extremely helpful, because I communicated with those people who had eye-opening experiences after visiting and attending lifestyle medicine conferences, annual conferences. And they said, hey, we need to start this program at our institution. We need to start this program, culinary medicine, or, the garden, or do educational, start curriculum at our, residency fellowship program, et cetera, et cetera. I think they benefit a lot. We need to start educating them and inviting them. Don't you feel like that's true?
Yeah, no, I think that's absolutely. I agree 100% with all that you are saying. I think the reimbursement is a big critical issue, and I do know American College of Lifestyle Medicine is big into kind of trying to do advocacy for higher reimbursement. Whether that also includes getting reimbursement for health coaches, let's say, or getting dietitians to be paid for being able to get dietetics or dietary training or access to dietitians really for conditions other than just diabetes or kidney disease. For instance, if somebody has so to speak only obesity, let's say, that's their only condition, and they have not yet developed diabetes. As of now, Medicare doesn't let you see a dietitian for only obesity, if that's if there is such a thing as only obesity. It sounds diminutive in a way.
Yeah.
But that's where Medicare or the government the Congress needs to act and be able to have. The truth is, most of our population would benefit from being able to have access to dietitians, etc. So there's a lot of health policy advocacy that I believe at least American College of Lifestyle Medicine or any other medical society should work on. Advocacy for basic access to lifestyle medicine services, really, because it's all of us it's everybody's skin in the game. All these administrators that you are mentioning, and really every human being in modern day world.
Yeah, every human being.
We all are we are marching rapidly towards disease if things stay status quo. One of the things that comes to my mind is if we are not improving, are by default deteriorating, right? And so if there is a handful of us who are healthy today, we will be facing some of the other disease if we don't act to preserve our health. Sure enough, yeah, and, of course. We need to all create that demand in terms of whether patients, like I said, I think patient demand has helped me personally in practice in making a case. Just showing, look how far out our lifestyle medicine consults are booking. How many patients want it, and if you have the numbers that patients are coming in purely for this, then that helps. And I believe that the demand will surge over the next 5 to 10 years.
It will surge,
patients will actually come to medical professionals for lifestyle medicine, and that's where we will win because the numbers are there.
Yeah, but I think it's also very important to educate about the existence of such services and such interventions of both patients and providers. And so they know actually to seek out those services and those interventions, because without this knowledge, they would not even know that those exist. And my next question to you, as I was thinking, you were talking and I was thinking, as an endocrinologist, because this is your primary specialty, you're trained to be as an endocrinologist, what are the most common lifestyle related chronic diseases that you see on a daily basis? And the next question would be, how can lifestyle medicine help to prevent, treat, or even reverse those conditions?
Yeah, so, some of these we already hinted at in our podcast. Obviously, type 2 diabetes, which is, 90% or more of all diabetes. And obesity is another very common endocrine disorder that is, again, very amenable to lifestyle therapy. And then I also see, endocrine disorders, people go to their local endocrinologist for other glandular or hormonal disorders like thyroid. That's a big one and very common. People go to their hormone specialist for gonadal disorders. So that could be polycystic ovary syndrome in women, young women of reproductive age groups or childbearing age groups.
Yeah.
And actually in that age group, the commonest hormonal disorder is polycystic ovary syndrome, also called PCOS.
Right.
And then, gonadal disorders among men would include hypogonadism or low testosterone. They call it low T, which is very commonly associated with obesity or excessive adiposity, I should say.
Right.
These are the common ones, and then there can be other ones like decreased fertility, again related to the gonadal issues or hormonal imbalance there.
Mm-hmm.
And these are all extremely amenable to lifestyle therapy. Now, there are some other, endocrine conditions which are less common, which, may not necessarily have lifestyle inputs or lifestyle therapy as applicable. If somebody has a pituitary tumor or adrenal tumor, that's different. That's not really a lifestyle therapy related disease, but again, those are less common. Most common hormonal disorders have a very sort of a very high correlation or amenability to lifestyle therapy.
Interesting. Dr. Gulati, can you explain to our listeners how lifestyle interventions affect those disorders and why? What's the mechanism? And would one disorder require a separate lifestyle interventions from the other disorder, or would it be like similar interventions for all because of the similar disease mechanism, or one common disease mechanism for chronic cardiometabolic diseaers?
So I think that's an extremely astute question. That's $1 million question. I love that. That's fascinating. And the truth is there is a huge degree of similarity among these different glandular disorders. The basic underlying cellular pathology in all of these different diseases, whether that's diabetes or obesity or hypogonadism or decreased fertility in some instances, not all, but in some, and even thyroid inflammation or thyroid autoimmunity. All of these come from underlying basic cellular shared mechanisms, which are, oxidative stress or inflammation or, cellular membrane dysfunction or insulin resistance or, decrease in or pathology in the way that the cell autophagizes itself. Mm-hmm. So there are all these, very sort of esoteric mechanisms which are extremely sensitive. I mean, they sound esoteric on paper, but these are, the basic biology that all of our cells go through. Mitochondrial dysfunction is a big one, right? Mm-hmm. And so what happens is if we are living in toxic lifestyles, whether that's, sleep deprivation, right? So we are rarely sleeping 4 or 6 hours and burning, the midnight candle, and then trying to, eat a nutritionally poor diet, packaged foods, ultra-processed foods, sedentary, working at our desk jobs, etc. All of these lead to the same pathology. And it really depends on an individual's unique sort of propensity, which place that, toxic lifestyle will eventually manifest or hurt. Whether this individual will develop diabetes at a lower BMI or whether this individual will end up gaining significant amount of weight or obesity and may have some pre-diabetes, some, pre-hypertension, some degree of high cholesterol. And in some individuals, that toxic lifestyle will manifest in decreased fertility and decrease in their, gonadotropins, the way the pituitary axis works. And that would lead to low T, or that would lead to, poor ovarian function in women. And some people will develop thyroid autoimmunity from these same toxic lifestyle stressors, right?
Right.
And the underlying pathology is quite shared. It really depends on an individual's biology, their unique propensity, which place it will manifest in. Some people will get, other non-endocrine things like migraines or, irritable bowel syndrome, etc. Mm-hmm. But you were very clever in mentioning that these are all kind of the same hits at the cellular level, at the mitochondrial level, and they all will be super sensitive to therapeutic lifestyle changes. Now, the intensity may differ. Some people will need a higher intensity, and some people will benefit from just a low intensity, minor changes in lifestyle,
Right.
stepwise fashion. But everybody will, have some improvements in their pathology if they apply the basic therapeutic lifestyle behaviors. That's basically sleeping better, moving more, taking frequent breaks from the desk job, eating less processed foods and more vegetables and fruit and legumes and so on. So
Right.
yeah.
Can you give us a very good example, like an example of a patient or like a spectacular success story of one of your patients that illustrates how implementing those lifestyle medicine interventions changed the course of their disease or their life? I love those stories, and people tell me how they like changed their life completely.
Yeah. No, I have quite a few amazing, fascinating stories that have really, brought, have been kind of like a godsend moments to me in my clinical practice. Very gratifying.
Yeah.
Kind of those stories which make you realize, oh my God, that's why you are a doctor, right?
Yeah, I made it as a doctor, right?
It's so gratifying. It really is. Such an opportunity to be this agent of this change in someone's life, and that's what it's all about, right?
Yep.
So one of my patients, she had been seeing some other provider in the community, and she had called me one night when I was on call. With her sugars were very high, 300s or 400s. This was right after Halloween, actually. I think this was in before the pandemic. And so it turned out she was eating a lot of Halloween leftover candy. And, obviously we talked about adjusting her insulins, and I told her to come to the office within a few days. And, that's a very typical endocrine practice. Most of the diabetics who come to see us, they either are already on insulin or they come to see us to start insulin, right? Because that's when people actually, unfortunately, get referred to endocrinology.
Yeah.
In our country, most diabetics, they don't come to us in the beginning of or the starting of their disease.
No.
They come to us when it's already advanced.
Right.
So in my patient's case, she had been on multiple daily shots of insulin for over 10 years. And she would be called, what you would say, class 3 obesity, BMI over 40. I think hers was over 45. And she had been, a breast cancer survivor. She had gotten breast cancer earlier in her 40s. Now I think she was in her early 50s. So, piece by piece, we kind of like talked a little bit about avoiding ultra-processed foods that would cause her sugars to go, to surge into the 400s, right?
Right.
But she attended our shared medical appointment, that cooking demo.
Right.
And I remember, I'm very lucky to work with my amazing dietitians who are super experienced. But my dietitian, she brought some kind of a smoothie, and she had a magical secret ingredient that she asked all of our patients to guess. Now, this is all pre-pandemic. And my patient and her husband's very supportive. They sat there and nobody could guess, none of the patients could guess the secret ingredient, which was actually a cauliflower. So, everybody was mesmerized how, because, when you think cauliflower, you don't think a smoothie, you don't think that can go with bananas and blueberries.
Yeah.
But it really stayed silently secret, it didn't declare itself much. And
I have to try that.
My patient and her husband, they were like, okay, if we eat like this daily, several times daily, then really we'll be able to get a handle on our diabetes and our disease.
Yeah.
And I think, that one cooking demo really kind of ignited the bulb, right? It was, they say show, not tell. If I had told the patient to go eat a cauliflower or eat vegetables, that doesn't make a dent, right?
No, yeah.
Actually show it to them, and you show how tasty real food can be. That bananas and blueberries, they taste pretty good, right? If you just have like a couple of minutes to kind of wash them and stuff, right? That, I think, act really made a huge difference in how she approached food. And I think that was a transformational point in her life. After that, she made some changes with her food. And I think over the next 1 year, she was able to stop her insulin altogether.
Wow.
Yeah, and she was able
Wow.
to lose a huge amount of weight.
Wow.
So this is a patient. Now I want to be very cautious here,
Yeah.
and be like you mentioned our expert consensus statement on diabetes remission. And there are some patients who've had diabetes for so long who may not be able to completely come off of insulin.
Mm-hmm.
They'll still benefit from eating better. They might be able to really minimize their insulin. But in her case, she was able to come off insulin. And then, for some reason, again, it's highly individual, and there is obviously no judgment or anything here. But my patient, she chose to go through bariatric surgery.
Mm.
And she did that, I think, somewhere at the end of 2021 or 2022 beginning.
Mm-hmm.
And she was able to come off every single medication, including metformin. So
No,
she
really?
officially reversed, or remitted, I should say, not reversed.
Oh my God.
She has remitted her type 2 diabetes that she had for over 10 years,
Mm-hmm. Mm-hmm.
which was a huge, when I talk about that patient, when I see that story,
Mm-hmm.
and when she came back to see me, once her diabetes had been reversed, I remember she was in tears, I was in tears, her husband was in tears in the office, everybody, we were all crying happy tears.
Mm-hmm.
But this is what it's all about, how if you give the lifestyle therapy at a dose that is, intense enough, you have to dose it correctly.
Yeah.
That it can really, really get to the stem, the root of the pathology.
Yeah.
And it can uproot that pathology out. In her case, she discovered how joyous, how fun it is to eat well.
Yeah.
How tasty it is, how delicious it is.
Yeah.
And that really worked for her. And there was no looking back after
Wow.
that.
Well, that's one amazing story. Oh my God. Every single medication, that's unbelievable. That's something just, oh goodness. I wish everybody was like this, right? We would be just reigning over medicine.
Everybody would come to that cooking demo. Unfortunately, there are practical constraints.
Mm-hmm.
Sometimes people cannot come because it's a long event. It lasts typically 90 minutes.
Mm.
And people have, jobs to go to.
Yeah, yeah.
Or there are other constraints. But, I wish that everybody had access to this type of medicine. They really should. Especially if they have never been brought up or raised with vegetables, right? And unfortunately, that is a harsh reality for so many Americans. They have never ever been, they have not grown up with vegetables or fruits or legumes particularly. That's a big blind spot for us, right?
I think I heard, yeah. Somebody told me recently, somebody told me recently they never had a salad. Mm-hmm.
Yeah, and then that experience is what changes people's mind when they feel, oh, this can be done very easily, very affordably, very inexpensively. And it does not take a lot of time. The amount of time it would take to make that smoothie would perhaps be less than standing in a McDonald's drive-thru, right? Or ordering and then going and back home or taking out.
Sure.
And it really is no compromise on taste. The taste is phenomenal.
Mm-hmm.
With the spices and with the bananas and the dates, and there really is no compromise on taste.
Sure.
That's what seals the deal. And this is the kind of medicine that people need to have access to.
Yeah, yeah. Speaking of barriers to success, by the way, because these are our main problems that we cannot really, we will eventually, as providers, as practitioners, will scale up, right? The art and the science of lifestyle medicine. It will be widespread around the country and the world. And we will have our place under the sun as every other specialty, if not more, with time. In several years, I predict in 5 to 10 years, we will be reigning over the world as practitioners. But now, as far as the barriers to success for us and our patients, especially your patients, as they attempt to make comprehensive lifestyle changes, what are those barriers?
I think, Dr. Shamoon, the biggest barrier is support.
Support.
Now, support of their families or support at workplaces, etc. So in my patient's case, this example that I gave, I think her husband was amazingly supportive. He came to every single one. I don't think my patient goes to any appointment alone. Her husband's always by her side. And, this is what pans out from all the data and the science also. For example, the DIRECT trial, one of the biggest trials for diabetes remission, that came out of the Newcastle in the UK, which really kind of is one of the the biggest studies that we quote for type 2 diabetes remission from lifestyle approaches. And their data, as well as so many other meta-analyses from different lifestyle trials, they all kind of point to social support as the biggest determinant of who will maintain weight loss, let's say, for diabetes remission, right? Because, in that study, it was about whoever had more weight loss ended up having a higher rate or a higher chance for diabetes remission. And they saw that, those patients who lost more weight, their spouses also lost weight.
Yeah.
Yeah. And so I think it's about having a community of support. Like I mentioned earlier in your podcast, I could not do it alone. Nobody can do it alone. I don't think I know a single human being who can do things on their own. We all are a team. Together, everyone achieves more, as they say, TEAM, team. Together, everyone achieves more. But the barrier that people may have, which I see commonly, patients have, oh, my spouse will never do this. Oh, my children will never do this. Oh, I have a job I work at and I can never do this.
Yeah.
So it's the support or the culture that they live in. And that's why we need a cultural paradigm shift. We need a culture of health. We need, workplaces, employers to care for their employees' health.
So what do you do?
Their employees a break for.
Yeah, but what do you tell your patients?
With healthy food.
Yeah, but what do you tell your patients when they tell you, I don't have support in the family? Do you bring the family members in?
That is usually, yes. So there are, nuances to what challenges everybody is facing. If it is their husband who will never not, stop eating red meat.
Yeah.
Then we have to kind of do sort of a motivational interviewing. What would be an alternative that both of you could settle on? Because the last thing you want your, the poor woman to do is to cook 3 different meals for 3 different people in the family.
For sure.
So what would be acceptable to everybody? Or how could you get your husband on board? Is there something that he cares about that would affect his approach towards red meat? Could it be that he suffers from ED?
Yeah.
And that eating less red meat may help ameliorate that? What matters to him? What moves the needle for him?
Right.
And the spouse would know that.
Yeah, of course.
What is it that the husband treasures?
Of course.
And how can she make a case that, this would help him achieve that? But it's harder when, you don't have the spouse in the room or the family in the room.
Yeah, of course.
And that's, I think, that's where having a shared medical appointment helps, because then, you have 3 or 4 different people in the room with the same problem. And then they can chat with each other, and then they're like, but this worked for me. That works for me. They share their experiences, their wisdom, their tips and tricks, and all that works. Yes. Yeah, absolutely. And, we are running out of time a little bit, but I wanted to ask you this last question, Dr. Gulati. On a personal note, when I met you in November last year at the ACLM annual meeting in Orlando, Florida, you struck me as a very young, happy, and cheerful, and super energetic person. You exude wellness personally. What are your secrets to your personal best health? And what is your antidote against burnout? Oh, you know what? I am so grateful for you saying that. I don't really know if I deserve that, but I really, really appreciate. I'm genuinely grateful for your saying that. That makes my day. You're so kind and so gracious. Thank you from the bottom of my heart. I don't know if I am completely burnout proof. I do feel burnout from time to time. It's a hard road. And I don't want to give the the illusion that it's easy. It's not. But it is, life is meant to be meaningful, not easy.
Yeah.
It's about the essence of life. It's not about the ease of life, right?
Right.
And, the truth is I do a lot of general endocrinology also, and many patients don't want to talk about lifestyle and, they may want to talk about other things like armored thyroid or weight loss medication. And to each their own. It's no judgment, right? No demonization, and whatever works for whoever individual.
Sure.
So that's that. But to answer your question, I'm not completely burnout proof. However, my secret might be that I always look to people like you. I know you met me with Dr. Beth Fraley's, who's my mentor, and other lifestyle medicine, people who I've gotten to know over the years, and kind of associating with them and not, isolating myself. When I'm burning out, I feel like I need to reach out and I, ask for advice. I'm not shy to ask for help when I need it.
Yeah.
I think that's a big so-called secret, if you can say it, or a key. Whenever you feel lost, you can ask for help. Don't hesitate to ask for help.
Yeah.
I think has been my mantra, to make sure I reach out to people who I trust, who I look up to, who I know will be the shining light in my life. And that kind of keeps on helping me go back to my passion.
Right. And this secret ingredient, the secret sauce of like-minded people of our American College of Lifestyle Medicine, I found this fascinating. Once I found ACLM for myself, it was my tribe. It was my tribe immediately. It was several years ago.
I think it's our tribe.
It elevated.
It's also good for pursuing, like you said, having personal wellness goals.
Yes.
So, sometimes we'll do challenges. I think, when we were meeting in Orlando, they started this Race to LM fitness challenge.
I know.
And everybody had to do a certain amount of, I think, metabolic equivalence or MET exercise in order to, and, they were like, okay, let's see who's the winner, who gets the most METs. So those kind of group challenges, I kind of periodically engage with. Sometimes we'll do some kind of 5-day, let's say a diet challenge where we will try to go low calorie for 5 days to kind of do a reset or something. Because, I cannot restrict calories on my own. It's miserable. It's really a suffering if you do it alone. But when you do it with, 10 other people, it becomes a celebration. Everybody's like, ooh, look, what are you doing? And, you're texting your friends.
Right.
So having that community to me is my biggest key to make sure that I have others with me who can keep on having my back if I fall. And, we can be that person to others.
We can be.
It's a bi-directional relationship. We shape our environment as much as our environment shapes us. We can give back.
That's for sure. And we should always,
I think, we all can affect the system. Of course, the system affects us bigly, right?
Yes.
But we can also be a part in determining the system. And we have the power. We have the agency. We are not powerless. We're not helpless. We can, you're talking with me. You and I can give this sort of education or share this resource with each other and with your listeners and with so many other people who might be listening. So yeah, we're not alone.
Wonderfully said. Wonderfully said. Amen, Dr. Gulati. Dear Dr. Gulati, thank you so much. I cannot thank you enough for this fascinating discussion today and for taking your precious time to be with us on this episode of the CardioSeeds podcast today. We really tremendously appreciate your insights and everything that all the information and all the insights you shared with us today. Thank you.
Thank you so much for having me. It was really my honor and my pleasure. The pleasure is mine, really. Thank you.
And this is all for today. It was your host, Dr. Svetlana Shimon, a lifestyle cardiologist from the suburbs of Philadelphia. Have a nice day and see you soon. Goodbye.